This is Selma Schimmel, and this is Unique and Unmistakable Amsterdam. The cultural and commercial capital of the Netherlands is used to being the center of attention, and this year is no exception as it hosts the European Cancer Congress 2013. This is a multidisciplinary cancer congress sponsored by ECHO, the European Cancer Organization, ESMO, the European Society for Medical Oncology, and ESTRO, the European Society for Therapeutic Radiology and Oncology. Bringing together the most imaginative and innovative minds and researchers from across the continent and around the world to engage global stakeholders, coordinate a unified oncology community, and speak with one voice. Vital Options Advocacy in Action is here to do the same, bringing together influential leaders of the cancer advocacy community for a three-part advocate forum. This is our fourth European Advocacy in Action, and we are so proud to be in Amsterdam, grateful to be partnering with ESMO and ECHO, and honored to bring it to you. So I'm going to start with you, Professor Eniu, and with the expansion of oral therapies, which enables patients to take their drugs at home rather than a clinic setting. Oncologists have a huge responsibility to address the issue of compliance. And in the end, you have to rely on your patients adhering to therapy. You can't see it. You ask your patient and you hope and trust that they're following your orders. So what are the challenges of the medical community in this area?
I think the issue of compliance and adherence is vital to the treatment that we offer to our patients, especially because, simply put, if you don't take the drug, there will be no efficacy of the drug. Especially, as you mentioned, with the advent of the new oral therapies, this is becoming more of a problem. I would say that what we see in the clinic, there are mainly two different scenarios, Compliance of the patient in the setting of toxicity, which is the main reason why the patient would stop taking a medication. And compliance of a treatment that it's basically non-toxic, but actually the patient would not have the confidence that it helps him. So there are these two different issues. The issue regarding toxicity, I would say that it's the most important one. Obviously, if you feel sick when you take a medication, you will think twice about retaking that tablet. And to deal with this, I think there is the medical oncologist and the nurse has the greatest responsibility in that issue. My experience is that prevention of and actually explaining to the patient what is going to happen is very helpful. The patient will stop taking a medication if she sees or he sees some unexpected toxicity. But if the patient is trained and knows what to expect, they will be much more prepared. They will know what actions to take. So they will be less likely to stop taking the medication. So from my point of view, I think it's really important to discuss at the beginning of the therapy with the patient which is the profile of toxicity, what she or he can expect, how to do the prophylactic measures to prevent those things happening, and obviously to give her some support materials or the telephone number of a nurse in case she has or he has any questions, so that because sometimes patients are much more closer to their nurses than to their doctors, and so they will.
Thank you.
It's a fact. It's a fact, and we all recognize that, and they will tell you much more detailed stories than they will tell me, exactly. Definitely. So I think this is one very important key element: explaining toxicity, getting the message through, and dealing with it before it happens. Now, the other thing is trying to maintain compliance of a treatment that spans over years. We have now data that, for instance, hormonal therapy in women should be continued 10 years and even more. How can you convince someone to take a pill for 10 years? I think the key there is to explain the importance of the treatment. Explain what the treatment does and what we expect from the treatment. And of course, explain the potential toxicities. But usually for this kind of therapy that I'm telling you about, the adjuvant hormonal therapy, is associated with much less toxicity than oral chemotherapy, for instance. So here we see this issue of patients just getting, bored of taking a medication over and over again for over 10 years. So I think here the key element is trying to explain what the efficacy of the drug is and how important it is to take the medication.
Thank you, Dr. Eniu, Jan Geisler, and Anita Margulis for being part of this interactive panel.
Welcome. Thank you.
Thank you.